Welcome to this month's team brief. Today we had a trust update where Tom Smurden talked about operational performance issues, Simon Marshall talked us through the financial pressures, Erica Heppelston gave us some really good tips in preparation for the CQC visit, and Chris Bell gave us some important updates regarding car parking. We also had a discussion about the new leadership framework, and I led the discussion on medication safety.
I'm Tom Smurden, I'm the Director of Operations for Unplanned Care, and I've been talking about the operational pressures which have been facing the hospital in the recent weeks. Clearly we've been very busy this week. You will all know that we've had to close off the corridor at the back of A&E for patient care, and obviously we'd ask that people respect that on behalf of our patients to maintain their dignity and for our staff to work with them. The things that we do which help us to manage those kinds of pressures are really important, and we meet every day now with our partners in the system at 11 o'clock to go through all the patients that are delayed and need just discharge planning support. It's really important that we participate in that and we make that work as effectively as we can. But of the 400 patients that are in the hospital, 400 adult patients, only about 50 or 60 are delayed at any time. So there's a lot of patients to go out there who don't need that sort of support. So I'd really encourage ward teams, all professions to work together to get those simple discharges moving as quickly as they can. Make sure that for every patient every day something happens to move them on through their journey, and be highly intolerant of any delays and escalate them up your line management chain. The only other thing to say is in 5 or 6 weeks' time we come to start of the Easter holidays. Really keen that we do as good a job of planning for that as we can. Make sure that our medical and our nursing staffing levels on the wards in particular are where they need to be. So I'd really encourage all teams to start looking at that now so that we've got a bit of time to put in place all of our staffing plans for that break. Thank you.
Simon Marshall took us through the financial context for this year and next year. And the key messages are, despite everyone doing really well financially, we still remain 5 million short of our financial plan. However, we will continue this hard work in order that we finish in the best way possible financially. For the next financial year, there remains a real conflict between what NHS improvement requires with regards to a surplus and whether or not the way we do things remain affordable.
Hi, I'm Erica Heppelston and I'm here just to speak briefly to you about our final CQC preparations for next Tuesday's visit. I've just got 3 really simple messages from our team brief today. The first is to ask everybody in all of your teams to just think about those areas you'd really like to show the CQC that you're most proud of, and have the confidence to speak to the inspectors and tell them about what you've done over the last year. The next thing is just think about your personal, what I call kick me lists. Sometimes you think, I'd really kick myself if I didn't fix that, or if the CQC looked at this, I'd really be upset afterwards if it was within my gift to fix it and I just didn't. So if you could just personally reflect on your sort of kick yourself lists and just see if there's anything on those lists you can fix before Tuesday. And the third thing is to say, please could all doctors on Monday review every patient's medication chart in the PRN section and input the indications for those medications, because we still have quite some way to go in order to get that done. So thank you everybody, and if I could just ask everybody to do your very best. All of these actions per the action cards are things that we know that we can do, they're within our gift to do, so if everybody could just prepare on that basis, that would be great.
Chris Bell talked about the new car parking changes which will come into effect from April 2017. Most importantly, these changes will be in operation 24 hours a day, 7 days a week, which will affect the way night staff display their parking permits. Even though these changes will come into effect soon, we have checked and we will remain the best value for money hospital staff car parking facility in Surrey. If you have any questions about these changes, please contact Chris Bell directly on his email.
My name's Louise Mackenzie, Director of Workforce Transformation, and today I did a quick demo of our new leadership framework at Team Brief. So the leadership framework sets out the behaviours and the competencies that we're looking for in our first line and senior managers. It describes using the values-based behaviour matrix, those competencies, and it gives you a really good indication of how you can develop those skills, be that through training programs or getting you to go onto the website and giving you some really interesting web addresses to look at, or through just some handy tips about how you can develop those skills. And really the purpose of presenting it today was to say that the framework is now live, so if you click onto the intranet and go onto the SkillsNet pages, you will see an icon that says Leadership Framework, and if you click through that you'll see all of the resources that we've developed. If you want any support or if you'd like to know more about the Leadership Framework and all of the training programmes that are on offer, then please contact Judith Thompson in the training department.
Today I led the discussion about medication safety at Team Brief. And this is a topic that's really important to me. We detailed the top incidents which resulted in either fatalities or serious harm as a result of drug errors. And they centered around 4 main medication groups. We looked at these incidents in a general discussion and found that the major underlying cause was having a very busy and overcrowded hospital, where people's ability to comply with procedures and policies were compromised by how busy we were. And in some cases, poor practice slipped in, such as the use of verbal orders when giving medication, and prescribing medication was not as it should be. Despite us having policies and procedures that help us, in theory, deliver medications in a safer way, we were able to circumvent those and be quite unsafe in our practice, specifically around the use of 2-persons checks. These featured in more than one of the drug errors we discussed today. And that allowed us to focus on ways in which we can improve this safety intervention of having 2 professionals, not just one, helping us deliver medication safely. We ended the discussion by thinking about how we as a hospital create some of the conditions that lead to us making errors. We talked about how busy we are, the pressures we are under, the fact that we are trying to do more for less can put additional pressure on our clinicians when giving medications to patients. In addition, we talked about how we can alleviate some of these pressures. What are the things we can do, the ways we can behave as leaders to help us deliver care safely? Medication errors, like we've discussed today, not only harms the patients, but also the staff involved. If you would like some further information on the work that we're doing to improve medication safety, please contact our Medication Safety Officer, Fraser Brown, for some more information.